Hey guys, purpose of this video is to help those of you who might still be struggling with your population and your behavior and thinking about how we use theory to affect behavior change. This video is particularly targeted to our friends who are clinicians, whether that be an MD, a nurse, a mental health care provider, anyone who works in the clinical space. Because one of the challenges with this class is that I'm asking you to change your mindset, right? So if you were trained as a clinician, you try to improve people's quality of life by impacting the disease state. So someone comes to you, they have high cholesterol, and you do your labs, you talk to them, and you figure out, I can give them this medication that will lower their cholesterol. You're treating a disease state. And by treating that disease state, you hope to have an impact on their quality of life. As a health educator, someone who is working in the field of health education and health promotion, we enter differently. We acknowledge that these health outcomes and disease states affect quality of life. We talk about that, we acknowledge it. But at the end of the day, it is not our focus. We enter here at behavior change. So if you hear me say, when you start talking about a disease state, whether that be high cholesterol, diabetes, some sort of mental health crises, whatever it might be, my response to you will be in a very loving way, I don't care. And it's not that I don't care about those disease states, it's that from the perspective of behavioral sciences, and from what we're discussing in this class, we don't care. Our outcome of interest is behavior change. Long term, of course, we care about disease states and quality of life. But an underlying assumption of our work is that if I change someone's behavior, then their health outcome or disease state will change, which will increase their quality of life. We work in a more distal space than the clinician. And so if you are a clinician and you are used to thinking and writing about disease states, I need you to change your mindset. For the purposes of this class, you are focused on behavior change, not disease states. So if you find yourself writing about high cholesterol, you need to stop and instead write about a behavior that's going to change that cholesterol, right? Whether that be a change in diet, an increase in exercise, or some other behavior change, right? This is our focus. And our assumption is that if we change these theoretical constructs, the behaviors will change. As a clinician, you oftentimes struggle, perhaps, with doing this mental shift. The other thing that physicians struggle with sometimes, not just physicians, clinical folks struggle with, is this idea of an intervention, right? So let's talk about, what do we mean by an intervention in health promotion behavioral sciences? When you hear the word intervention, I want you to think about some synonyms like curricula, class, training, or public health program. So program, class, curricula, these are the things, a training program. We are not intervening at the disease state. Our interventions are programs, they are classes that help people change their behavior. So it's a different way of even using the term intervention, right? And in fact, what you'll find as you progress through your work in this field is that if I'm writing a research grant to like NIH, I'm going to use the word intervention. If I'm writing a grant to a foundation or to CDC or to SAMHSA or to HRSA, I will never use the word intervention. I'm going to talk about a program or I'm going to talk about a training class. And I won't even use the word research. Instead, I want to talk about program evaluation. So there's these terminology things that happen that are different. And so these words mean different things depending on your discipline. And right now you're learning a new discipline. Ultimately, you guys are becoming clinical educators. That's what we're training you to do, right? Is to do clinical education, potentially, if you're going to merge your two fields. So I hope this helps. It's a different way of thinking, and I need you to make that mental shift if you're still struggling, right? Also, I need you to give yourself some grace, because every clinician that takes this class or enters this program, I don't want to say every, most clinicians who enter this program, they struggle at first with making this mental shift. So give yourself some grace, give yourself some time. If you haven't fully made that transition in your thinking or in your writing, it is okay. It seems to me, just looking at students, it takes about a year. So recognize that you may continue to struggle with this for a little bit, but at some point it'll click in. And you'll be able to shift your thinking from, am I thinking like a clinician or am I thinking like an educator? And once you can shift your thinking, I think it'll help you out a little bit. Okay, I hope this video helps. You guys have a great day, and I'll see you Monday.